Hi, my name is Christina. I'm going to be your nurse today. I'm here to perform a head-to-toe assessment on you. If that's okay with you, it'll take approximately 20 minutes of your time. I'm going to close the door and I'm going to pull the curtain for your privacy. I'm going to wash my hands. I've already obtained your vital signs. Can you tell me your name and your date of birth, please?
Seth Mullis, June 6, 1996.
Seth, can you tell me where you are?
Beverly Hills, Florida.
And can you tell me the date?
February 21st, 2018.
Are you comfortable?
Yes, ma'am.
Okay. I'm going to start at your head and I'm going to end at your toes, okay? Patient appears alert and oriented ×3. Hygiene is good. Posture is good. I am going to start by verifying your name tag against your name. Very good. You are who you say you are and your date of birth is accurate. I'm going to check your head now for any nodules, parasites. I'm going to check your hair distribution, okay? So I don't see any parasites. I'm not feeling any nodules. Your hair is evenly distributed throughout your head. Very good. Seth, can you close your eyes for me, okay? And I want you to tell me where I am touching on your face.
Forehead, chin, left cheek, right cheek.
Okay, Seth, you can open your eyes. Can you raise your eyebrows for me, please? Okay, can you smile? Puff out your cheeks. Okay, cranial nerves 5 and 7 are intact. Next, I'm going to check your eyes. I'm going to first check for redness and discharge. I'm just going to pull down on your lower lid a little bit. I don't see any redness or discharge. I'm going to ask you to take a look at my light, okay, without moving your head, and now look to the wall behind me, and then back to the pen. Very good. I'm going to I'm going to shine the light in your eyes, okay? Pupils are equal, round, reactive to light and accommodation, 2 to 3 millimeters. Okay, Seth, I'm going to ask you if you could just cover up one eye and let me know when you see my hand.
Okay. Yes. Yes.
Okay, very good. Now we're going to cover up the opposite. Let me know when you see my hand.
Yes.
Stay focused on me. Look at me.
Yes.
Okay, very good. Okay, I'm going to ask you to plug one nose, plug the other nostril. Okay, I'm going to look inside of your nose. Tilt your head back for me. I don't see any lesions. I don't see any drainage. I don't see any deviation in the septum. Okay. I'm going to ask you to close. Okay. So that's cranial nerves 2, 3, 4, and 6 intact. Okay. I'm going to ask you to close your eyes, and I'm going to ask you to tell me which ear you hear a noise in.
Left ear, right ear.
Okay, that indicates that cranial nerve 8 is intact. I'm going to ask you to push against my hand. Okay, push against my hand. Ask you to shrug your shoulders. I'm going to ask you to move your head in a circular motion both ways, right and left. Okay, range of motion in the neck is good. Cranial nerves 9, 10, 11, and 12 are intact. If you don't mind removing your shirt for me, I'm going to be checking your abdomen and your best sounds and so on. But first, I'm going to start with your lymph nodes. So we have your submental, submandibular, tonsillar. I have your preauricular, postauricular, occipital, posterior cervical, anterior cervical, and if you could shrug your shoulders, supraclavicular. I don't feel any enlarged lymph nodes. I'm going to ask you to swallow for me. There we go. Okay. Good. I'm going to check your thoracic ratio, appearing 1 to 2. I'm going to ask you, if you don't mind, to lean forward for me, Seth. I'm going to check your spinal alignment. Spine is straight. Each time that I touch your back, Seth, I'd ask you to say 99.
99. 99. 99.
Okay, I'm going to check your kidneys for tenderness. Let me know if there's any pain or discomfort. Any pain or discomfort?
No.
Okay. Next, I'm going to check for your thoracic expansion. I'm going to ask you to exhale deeply. Okay, now inhale. And exhale. Thoracic expansion is equal bilaterally. Next, I'm going to check your breath sound, your lungs, okay? Your respirations appear even and unlabored, no use of accessory muscles, no cough. If each time I place my stethoscope on your back, if you'll just take a deep breath in and out through your mouth, okay? Okay. So I'm going to move around to the front and check your breathing in the front, the lung sounds. No adventitious lung sounds noted, no rails, crackles, wheezing, stridor. Okay, Seth. Next, I'm going to ask you to lay back and let me observe your abdomen, okay? You just lean back. Okay, no noted scars, lesions. I'm going to listen to your abdominal quadrant, starting in the right lower quadrant. Bowel sounds present in all 4 quadrants. I'm going to palpate your stomach. I'm going to touch your stomach and I want you to let me know if there's any pain or discomfort, okay? Any pain or discomfort? No masses. Stomach is round, non-tender. Bowel sounds present in all 4 quadrants. Seth, can you tell me when the last time you had a bowel movement was?
This morning.
Okay. Any problems with your bowel movements? How about the last time you urinated?
30 minutes ago.
30 minutes ago. Any pain or discomfort upon urination? Okay. I'm going to check your upper extremities for any edema. Any deformities, scars, lesions. Check for temperature. Temperature is equal bilaterally. No scars, no edema, no lesions noted on the upper extremities. Check your capillary refill. Capillary refill is less than 3 seconds. Brisk in the upper extremities. I'm just going to check your capillary reflexes and the refill in the lower extremity. Less than 2. Brisk. I'm check for edema. Deformities. Not seeing any deformities. No edema noted. No abnormalities. Temperature is equal bilaterally in the lower extremities. I'm going to have you sit back up, so let me help you. I'm going to check your pulses, okay? I'm going to start with your carotid. Carotid pulse is 2 plus your carotid artery. I'm going to check your brachial. Brachial pulse is 2 plus. Radial. Radial is 2 plus bilaterally. Popliteal pulse. 1 plus bilaterally. Posterior tibialis. 1 plus bilaterally. Dorsalis pedis. 1 plus bilaterally. Okay, let me see. I'm going to check your heart sounds. Right, second intercostal right sternal border, aortic. Second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, Erb's point. Fourth intercostal space, left sternal border, tricuspid. And fifth intercostal space, left midclavicular line, mitral. No murmurs noted. Okay, next I'm going to check for your, I'm going to check your reflexes. So I'm going to start with your tricep, if you'll just let your arm dangle. Okay. Your bicep. Your radial. Just keep it calm. Okay. I'm going to do another thing. Bicep. Bicep. Radial. Okay. Your patella. Patella. Achilles. Achilles. And posterior tibialis. No posterior tibialis. Okay, next I'm going to check for Your plantar reflex. Plantar reflex. Okay. Reflexes are good. Reflexes. I am going to check for your. I just had it and I lost it. Ankle clonus. Ankle clonus. Okay, so I'm going to ask if you don't mind if you'll just stand up for me, please. I'm going to ask if you will just walk to the wall and then turn around and walk back. Okay, be steady. Okay, if you'll just stand with your arms at your side, feet together, close your eyes. Okay, balance is good. Negative round bird test, so if you can have a seat back here. Can you please, you can open your eyes and have a seat back here. So, feet together and your arms outstretched. Okay, now back down at your side. Okay, that's good, Seth. Thank you. Negative round bird test. Let me see. Now I'm going to check for your, I'm going to check your strength, okay? So I want you to squeeze my hands, okay? Now I want you to put your hands up like a boxer. I want you to pull against my hands. Okay, now don't allow me to push. Very good. Now with your arms, push out. Okay, push in. Now we're going to do the same thing with your lower extremities. I'm going to ask you to push out. Okay, push in. Okay, push out. Okay, and try and pull back in. Very good. Strength is very good throughout all extremities. This would conclude our assessment. Is there anything that I can do for you while I'm here? Are you comfortable? I'm going to give you your call bell, okay? And I'm going to wash my hands and document my findings. And if there's anything that I can do for you, please don't hesitate to call. Thank you for your time. Hi, I'm Christina. I'm your nurse. I met with you earlier. Seth?
Yes, Seth.
There's a few things that I just forgot to do on the previous assessment, so I'm going to close the door. I'm going to pull the curtain. I'm going to wash my hands again. If you don't mind me taking a few minutes of your time, I just wanted to state that that your speech is clear and articulate. I'd like to just take a look inside your mouth and check your mouth for any lesions, sores, okay? How do you say stick your tongue and say okay, so your uvula is midline and rises with phonation. Tonsils are +0. I don't see any lesions or sores in your mouth, and your teeth are all intact. Lift your tongue up, there we go. Oral mucosa is moist and pink. I forgot that when I was in here earlier. I apologize for the need to come back. I also want to check your range of motion if you don't mind. So Seth, if you don't mind, just like shrug your shoulders for me, front and back. Okay, and move your wrists. Okay, your elbows. Okay, and if you could do the same with your toes, your feet, move your feet one way in the opposite direction. Your knees. If you can move your knees in and out. Okay, and if you could just raise up your leg. Range of motion there. Very good, Seth. I think that's about all. Thank you for your time. Is there anything else that I can do for you? Okay, here's your call bell, Seth. And if you need anything, please don't hesitate to call. And thank you again. I'm going to wash my hands, document the rest of my findings, and you have a nice day, Seth.